together. Hey, everyone. So as I said this morning when we were getting started, your chair had a headache yesterday afternoon and didn't notice that we did not do a complete vote on the bill. And so we are going to try this whole thing again. So first we need a move on the amendment and then we need a motion on the bill.
On S94.
Indeed.
Who made the?
I think usually the two of you work out.
If I was first, then I moved the amendment.
Maslin moved and Anthony seconded. Right.
Great. Okay.
Thank you.
Thank you. So Representative Maslin moved that we amend S94 and
Peter, Anthony, seconds.
wonderful. Representative Anthony seconded. Any discussion of the amendment? Seeing none, if clerk could please call the roll.
Andrews, yes. Anthony,
Yes.
Beck,
Yes.
Brannigan,
Yes.
Stemro,
Yes.
Maslin,
Yeah.
Matos,
Yes.
Bodie,
Yes.
Sims,
Yes.
Taylor,
Yes.
Canfield,
Yes.
Kornheiser.
Yes.
Okay. I
And
thought
now the next step
Oh, I see we forgot.
is the bill.
Indeed.
I fully understand. Okay.
Make a motion, we vote on the bill as amended.
Thank you so much.
Second.
Representative Demrow moved that we find the bill favorable as amended, S94. Representative Anthony seconded. Any discussion? Seeing none, if the clerk could please call the roll.
Andrews, yes. Anthony,
Yes.
Beck,
Yes.
Brannigan,
Yes.
Stemro,
Yes.
Maslin.
Yep.
Matos,
Yeah.
Bodie,
Yes.
Sims,
Yes.
Taylor,
Yes.
Canfield,
Yes.
Kornheiser.
No, thank you. I think we all did really, really, really very good work. It wasn't an. I think I've made very clear my feelings about veggie and TIF, and I am happy that we are improving the program, and I thank you all for your very good work.
But
May I quote you?
You may. No, you may not. The internet has preserved it forever, though. This afternoon, we're going to talk about a local option tax, and maybe you could think, Representative Ansel moved the local option taxes through and had her own feelings about it, and that is how I'm going to carry on my life with the TIFs and the veggie. So, and Representative Anthony is going to report the bill. Thank you for that. So with that, let's go back to talking about childcare. Ms. McLaughlin, would you like to join us?
Yes, thank you, Madam Chair.
The floor is yours if you want to introduce yourself and
Sure.
tell us everything.
Okay, so hi, everybody. I'm Janet McLaughlin. I'm the Deputy Commissioner within the Department of Children and Families, and I lead the Child Development Division. I have been in that role for about 5 weeks, so there may be some things that I need to get back to you on it, but I have been working on early childhood issues in the state for about 8 years. So some of the stuff I'm familiar with from before joining. Did my slides make it to you? Okay.
Did you just send them?
Sorcia's been having some airwave problems, so it might not be you.
Okay. No, I didn't just send them. I think this was coming together sort of late
Yep.
yesterday afternoon, and so I think maybe my instruction of send the house slides here didn't get fully translated.
Would you like to share your screen and then we can follow along with you?
Yes, but I'm not in the Zoom yet.
Okay.
I'm gonna send you the,
And it's okay for us to sit here a moment while you find your way to the
Thank
Zoom.
you.
No one has to make fun patter while we get there. We can all just sit and think other thoughts for a minute.
Okay, yes, everybody, it's time for some meditative breathing. I plan for a grounding exercise at this moment in time. And that was approved.
We're in study hall.
It's really nice. I don't know if I ever went to.
Can we do this more
I
often?
don't think I ever went to study hall in high school. I don't even know if we had study hall. Do schools still have study hall?
Yeah.
Anyone? I think I just went to detention and didn't there, to be perfectly honest about the situation that I'm in.
Skip study hall, go right to the
I
detention.
think that is actually what happened. But it works just as well. So it's actually the exact same atmosphere as study hall, it's just a different crowd.
Getting there. Okay. Here we go. So thank you guys for your patience. We're in here now. I am obviously sharing some slides that we shared with House Human Services, but I did get the chance to listen to my colleagues, Emily and Renee, give this testimony last week. So I think I've mostly caught up with it. The things that I wanted to review that I think these are the things you'd like us to review, and you guys can tell me, right, is just the design of the Child Care Financial Assistance Program. Talk a little bit about Head Start in Vermont. I also have some information, sort of trends, if we have time and that's interesting to you as well. So overall, big picture, the Child Care Financial Assistance Program, is administered by the Child Development Division. The program provides some or all of the costs for early childhood education and childcare for eligible families with children between the ages of 6 weeks and 13 years old. Sometimes 19 years for children with special health needs. And the design of the Child Care Financial Assistance Program, right, reflects the requirements of our federal funding source, which is the Child Care Development Fund. And those requirements are really related to, right, like who is eligible, how much they're eligible for, how much to pay programs, and then how program integrity is maintained. So there is, as you I'm sure know, right? These federal grants come with lots and lots of requirements and required documentation that the division maintains. The graphic over to the right, I wanted to include just to make sure folks know there's really 4 key sort of players in how the Child Care Financial Assistance Program is administered. Obviously, there is the family who actually decides they want childcare and applies for Child Care Financial Assistance. They do that by applying to a community child care support agency. That's who actually determines the eligibility. And
So in like our communities.
out in your communities, yes. And I have a little flow chart later on.
Oh, great.
Yep. And then there is, so that's, they are actually determining eligibility. Obviously, there's the child care program, which also has to decide that they want to accept child care financial assistance dollars, right? And obviously provide the services to the children. And then, right, the Child Development Division, which sets the standards for the program, but then also makes payments directly to the programs on those children's behalf. So I have slides that sort of walk this through, but I just wanted to flag that in terms of like these 4 key players in the system to keep in mind. Right now, CCFAP funding totals $62.75 million. And I think it's worth pointing out, right, 36 million of that is coming through state funds. Some of that is a required match. Most of it is investments that are choices by the state. And then there's the federal funding, which comes from the Child Care Development Block Grant. We leverage the TANF block grant. There also is funding that comes from Family Services Division. And so that is the money that can support child care costs for children who are eligible for other, basically for other DCF services, you know, that might have an open family services case, things like that. And then there's also global commitment dollars and that is really for therapeutic childcare and for children that have special needs. A couple key points to make, right, is that the federal funding sources are being fully utilized right now. We are, I think, draw down like as much money as we can in every possible way. And obviously this is not all of the money in the early childhood education or childcare system, right? This isn't including the money that families pay out of pocket. It's not including Head Start grants. It's not including universal pre-kindergarten funding.
Yeah.
So,
If I may.
yes.
I'm curious about children with special health care needs and
Yes.
their care.
Mm-hmm.
And my question is, I think we understand the sort of dynamics of the typical quote-unquote childcare system.
Yes.
Is the special health care needs system stressed in the same way?
Yeah, I mean, I would say, let's see. I don't know that I've talked to my colleagues about that question that exact way since I've stepped into this role, but I would assume that the answer is yes. We do have a specialized childcare program, right, that's housed within Children's Integrated Services, which is another key program that the Child Development Division runs. And so that program is specifically tasked with making, you know, with finding and sustaining childcare for children who may have developmental delays, may be at risk of developmental delays, may again, right, have these really specialized, have specialized needs. And that, so we do have people who are sort of tasked to be those matchmakers and supports. In terms of CCFAP, this is maybe a little bit obvious, right? But there's lots of different reasons why that you can qualify for childcare financial assistance. And I do have more slides that detail the income guidelines, but right, you have to meet the income guidelines. You have to be a Vermont resident. The child needs to be a legal resident of the United States. And you have to have a reason for care. And that is a part of the TANF, or the CCDF guidelines, is that you have to have a reason for a childcare. And so that can include having a job, being self-employed, looking for work, attending school or training, participating in Reach Up, again, special health need. And that can either be for the parent or for the child that has the special health need, have an open case with family services, or the family could be experiencing significant stress. So we do have family support childcare, and for families that may, maybe they don't meet the other criteria, or they can't get the documentation together for the other criteria, but we know that they're homeless, or we know that they are a newly arrived refugee family, and we can still, we have a process by which we can get those children into childcare financial assistance and get payments flowing on their behalf.
Go for it. Okay, this is, you know it.
I know it is too.
You do?
I
Okay.
think so. Go ahead.
Can you hear? So I have one very weird, weedy, specific question
Yes.
about the need for care.
Mm-hmm.
What happens if it is a two-parent household, one person is a W-2 wage earner, one person is self-employed, and in that year the self-employed individual shows a business loss?
Mm-hmm.
Are they eligible for care?
I will get back to you on that question, Catherine, and I did know that was going to be your question. Because I know the question around self-employment and sort of how do they calculate wages there. I know I have heard that question before, so I have not explored it in this new position, so I'll get back to you on how that's done.
Back to you.
Okay, so just wanted to, it is a complex program, so we wanted to try to break it out for folks. Oops, sorry, too far. So, right, just the high level for families, right? They're submitting they do have to submit an application to that local community child care support agency. These are often sort of parent-child center or other sort of family serving organizations in communities across the state who get a grant from CDD to process that eligibility. right? The eligibility specialist reviews the application. The standard is 7 days, it can often be faster than that. And then the eligibility specialist follows up with the family, is any more information that's needed. And again, the standard is 30 days with an application as a decision is made. It's often faster than that, but that sort of is the official standard because some cases are more complex. And then if a family is determined to be eligible, they get a statement of eligibility. And that includes their family share, and there's the next slide will explain that, their eligible hours and dates. So we do actually collect information on people's like work schedules and because sometimes some children are eligible for a full-time certificate and some for a part-time certificate. And then the assistance amounts, the amount that's going to be paid to the provider for the children in their care. And that is varies on a couple of different factors. Oops. So
Does everyone on the committee know what the agency in their own community is that does this eligibility for their constituents? Thank you. Can you give some examples of what the agencies might be that might host this specialist? Thank you.
So in,
I don't have to go through every county, but just sort of like.
well, in Brattleboro, right, the Winston Prouty Center does it in Brattleboro. I believe that the Lamoille Family Center does it in Lamoille. The Child Care Resources, who does it in Chittenden County. I think Umbrella is in St. Jay. So it's one of the, I think, in St. Albans, it's the children's, they do everything. I cannot think of their acronym right now.
Is that just through a contract?
Yep.
Yeah.
Yep. They apply to they apply to do that. And I will say in the governor's proposal and in what's in S56 and what I assume will be in H208 is increased funding for those child care support agencies. They really have not had their funding increased in at the rate that's needed for the work that they're doing, and especially since we're considering increased eligibility. And that means there's going to be more families that need to go through that process. We really need to include that support. So,
Just getting back to the question about that agency and assuming in Orange County would be the Parent-Child Center, is that right?
that's what I would guess too, but usually it is the Parent-Child Center, but every community, as you guys know, it's Vermont, right? Every community does things like a little bit different. Like, so it's almost like a standalone agency in Chittenden County, in some places it's, they have
Brattleboro Windham County splits the Parent-Child Center duties between the Head Start and another early care and education center called.
Yeah.
And I hear you talking about sort of capacity needs to respond to additional noise. Am I right in understanding that there are also like IT needs and we're maybe making some progress on IT needs?
Yes.
But haven't finished that project or what?
That's right.
Where are we at with?
Yeah, good question. And I'm happy to gather, again, that is a very complex project that I have not fully got into, right? But yes, we are in the process. It's called CDDIS, and it is the technology system that would process, it ideally would support all of the child care system overall. What we've done so far is move child care financial assistance eligibility and payments into that system. There still is features and functionality that we are working to build in that lots of people want. There's not yet a sort of a parent portal side of it, which is what would be needed for parents to submit those online applications to check their own eligibility. So right now all that work is happening through the eligibility specialist. There are plans to do all of that, but it is the more I learn about how complex all the different variables are in terms of the cases and the rates. And so it's not the typical scenario that causes the challenges, right? But it's actually when people have multiple jobs, right? That are, or they're shared custody or they're, there's a bunch of different, of factors, that come into play, or somebody needs care. There's a number of kids that have more than one childcare certificate because they are CCFAP certificate, because they might have one for during the school year and they have a different one for the summer or a different one for school breaks. So the more I learn about it, the more I do appreciate the layers of complexity and sort of the need to sort of urgently work on it. It's certainly, you guys have heard, right? Like IT within state systems has not necessarily been the most resourced area over time. So we are playing a lot of catch up on that system. The next step, the next things that some of the next big pieces that need to get into that IT system, our childcare licensing system is not yet in that yet. And that's really important to, just the health and safety functions that we need to play, as well as the workforce features are not in there yet as well. And so there's pieces related to credentialing and supports there.
Thanks. And I know I sort of sent us a little bit into the weeds. I just want to make sure that if and when we pass a massive childcare system
Yes.
improvement bill, we all know how to connect our constituents with this
I'm
improvement.
happy to make sure you guys have the link to that.
And actually Sarah Kenny sent it while we were all sitting here. So Representative Taylor and then Brannigan.
But just a quick question, how many FTEs are there in CCD?
Great question. There's about, I've never actually counted. What I've heard is there's about 50 people within a child development division, and that is both for childcare as well as for children's integrated services.
Thanks.
And where can we look that up? Because you said it's Franklin County, but then you couldn't remember where it was.
Oh.
Where can I? Is it
NCSS. Yes.
NCSS.
Sorry, I couldn't remember what NCSS stood for. So that's what it is.
Thank you.
I'm pretty,
And Sarah Kenny.
Sarah, is that
just
correct?
sent a link to all of us.
Okay.
Oh, perfect.
Well, she sent it to Sorsha and Sorsha sent it to all of us. Back to you.
This is sort of into some of the nitty gritty, right? That folks, for folks to understand, right? But we look at, in terms of the income guidelines, right? We were looking at the family's gross monthly income. That monthly income is a function of the federal poverty level. Right now, right, these are the current guidelines that go up to 350% of FPL. And then based on the family's income, then we set a weekly family share. This was a new design that was sort of, imagined 3-ish years ago and is now, we were able to flip the switch on it last July. So this is still new. But for the family share, that is the family's share, whether or not they have 1, 2, 3 kids, no matter how many kids they have in care. So that's been a big shift. And I think certainly families that are within the program have really felt that, and that have multiple kids have really felt that. And so it's designed to keep them closer to the income thresholds that were sort of imagined to be affordable for families.
And these percentages are, and like all of these numbers on these charts is like, one of the 2 key levers that we would be pulling in the bill.
Right. And so in the governor's budget, the proposal had been to move up to 400% of FPL. So that is how much the family would need to contribute, right? So that is sort of a separate question from how much does the state actually pay to that program. So we are paying, we are paying directly to the childcare provider on a family's behalf. And, we do have a set cap on what we're going to pay on behalf of a family. I will go to that slide next. And so we are paying that capped rate or the provider's rate, sort of whichever is less, sort of after subtracting that family share. So the current payment rates are set at it's set at 75th percentile of the market rate survey. This is one of the CCDF, the funding source sort of standard on a way to set this, and you need to set what you're paying as an amount that would cover tuition at 75% of the programs, right? The goal is that children that are using childcare financial assistance, would have, similar access to childcare programs in their community as families that are private pay. The intention there. And so again, the portion that we are paying depends on, that family's application, like how much their weekly share needs to be, what the provider's rate is, their rate agreement is what they have with CDD, where they're telling us this is how much we actually charge families. What the state's capped rate is So, right, and then that family share. So the family's application actually had to do with their work hours. So
Are there provider rate agreements that are lower than the state's capped rates?
there are.
Will you tell me more about that?
Well, so the provider, I think a good example, let me see if I'll just skip to this slide, which shows is that blurry for you guys too, or just me?
No, it's
Sorry, you guys.
It's okay.
So for instance, in this slide, you can see, right, the different ages of the children, the two setting, licensed care and registered home. You can see the different ages of the child, and then you can see the number of hours, as well as the star. So this is like, there's quite a lot of elements, right, on this matrix. But for example, right, there might be a program that, has their infant rate set at lower than $349 per week. And if they're not charging other families like more that amount, they can't charge the state that amount is the rule. So that is.
So there are programs that are 2 stars full-time for an infant that might be charging families less than $297.
Yes, there's not a ton, there's not a ton of them, but yes, that definitely, that does happen.
Thanks. That's okay.
Because the market rate survey, right, is set at an average and it's set at that 75th percentile. So those other percentiles must exist, right? So I'll just pop back real quick. Just in terms of for on the provider side, right, they do have to, they have to be a registered program. They have to be a regulated program by the state. They have to complete a financial agreement. Again, when a family is determined eligible, they are getting told this is how much you can use at any state regulated childcare program. But when they choose a specific program, then that program gets a CCFAP certificate so that they know how much when they're submitting their attendance to the state, they know how much they're going to get paid for that child. Again, they have to enter attendance on a biweekly basis. And then again, the providers are receiving payment based on electronically, almost all of them, based on what they've submitted. So now we're back to this chart again. What questions do you have about this that I might be able to answer? Yeah.
So in a licensed care or registered home, doesn't matter.
Mm-hmm.
If the center right now, they can charge the parents more than the CCFAP rate.
Mm-hmm.
And then the parent has to make up the difference. Is that correct? Okay. Are they bound to charge the same rate to those that are eligible for CCFAP and those that aren't eligible? So
they can set program. So, right, it's not the state's job to tell the programs how to arrange their plan, their payments. And so, but no, they're not bound to do that. They could establish a policy for their organization where they are going to give, sort of scholarship, that portion of it for families that have CCFAP, or they might give an extra sibling discount, or just give a scholarship to a family that doesn't qualify for CCFAP at all, but they know needs financial assistance. And those are definitely program choices that those individual programs can still make.
But these numbers are 75% of what the market.
What the market survey was in 2019.
Okay.
So that's another thing to consider is that, we do have another market rate survey coming this fall. But this was 2019 and we know, obviously there's been a lot of pressures on costs, in that time.
If we do nothing, these numbers are going to get bigger.
Yeah, that would be a reasonable assumption, I would assume.
Okay.
But the proposal that the governor's, okay.
Wait, no, actually Joyce is going to jump in.
Yes, Joyce Manchester, Joint Fiscal Office. May I ask, when was the $25 copay per week set? What year was that set?
So I think that program design was in H171. Yeah, so that program was designed in H171, which I think was
2019.
And it did just take effect in July, was when IT system was ready to implement the policy goal. So it's brand new.
Great, thank you.
Representative Anthony.
Just a worry following mine and Representative Beck's observation about what the particularly for-profit child center could charge absent any controls. That decision, whether you treat it as a scholarship or not, regrettably will turn out to be an accounting decision, not necessarily a rational one from
From a child development.
other,
perspective.
yeah. It'll be an accounting choice, which may skew some of your ability to get data that's useful. They're testing they were.
This was not.
Please, may I have your attention, please? This is a building evacuation. Gather your belongings if you are within reach and evacuate the building using the designated route.